from the wheelchair back to the back. So before we do transfer, it's always a good idea you get used to the device you are using, which is wheelchair, because there are a lot of types of wheelchair out there in the market. So if you have one, you make sure you get used to the device, how we are going to use, and you check before everything you make the transfer. So we will check the device first. So to use the wheelchair, we put it apart, and then you make sure you check the security belt can be fastened securely, and then you check the brake can lock both sides. So you check it's stable, and then you make sure you can remove this armrest apart, remove and then put back. It's on both sides, so you remove and then put back. Okay, and then the footrest you put down, and then you check it's working, and then this can be moved sideways and move sideways. Okay, so for the stroke patient who are really bedbound, bedridden patient, it's better you have the wheelchair like this, which the parts can be removed and put back easily. It will make easier for your transfer. So now I'm going to share with you what you're going to do and what you should not do while making transfer the resident from the bed to the wheelchair. So always remember, you use your leg muscle to make transfer. So we stabilize our legs like this. We make our foot apart, approximately like shoulder width, and we stabilize there, and we squat to make transfer, which means we will use the leg muscle like this. So whenever we do the transfer, we use like this one. So make sure you never bend your back like this to make or move or transfer or carry something, because it will hurt your back. So you use your back for making transfer to the patient one time, it won't hurt you, it will not obvious. But if you make it for several times, like days, months and years to many residents, for sure you will suffer a back pain for the later time. So make sure you don't use your back to carry things or to carry the residents or to make transfer. Because if we look at the anatomy of the backbone also, it has a vertebra which embedded inside the spinal cord. So if you hurt the back, you are sure to have the back pain later on. So please be very careful with your back. Please don't hurt your back. Okay, one more thing you make note of it is, when you make transfer from the back to the wheelchair to resident, you make sure you transfer from here to here using your leg muscle only. Like this, you make transfer from here to from here like this only. So what my point over here is, please do not twist your back like this from here to here. Please don't twist it. It may hurt to your back also. Okay, then one more thing is, you always remember to adjust the height of the back to your walking comfortable height. It means it should be around your waistline, so that it will make you easier to make a transfer. So I mean, you don't need to bend over to take things or to make transfer to the residents. And then after you make the resident from lying down to the sitting up position, you make sure you make the patient feet touch on the ground or touch on the floor. So it will make you easier to transfer from the back to the wheelchair also. And when you make the patient from lying down position to the sitting up on the edge of the back, when you lift the patient up, please make sure you lift from the shoulder blade, which is the trunk of the body. Please never ever lift up from the neck, because it will hurt to the patient to get injuries. And then you make sure you spend some time for the patient to sit in a while on the back before you make transfer, to prevent them from any postural hypotension or any dizziness, drowsiness, something you observe also. And then always remember to pull up the bedside rails for the security. Now we are going to start with the patient who needs minimal assistance, which means they may walk independently and stand independently on their own, but we still need to make sure they are safe. So we are going to transfer the patient with the minimum assistance. So you make sure the wheelchair placed in line with the bed and with a small angle near to the back. So you make sure the patient's lying at the nearest to the edge of the bed. If she's not, then you can ask her to move near to the edge of the bed, or you may ask your colleagues to assist you to move near to the edge of the bed. So it's always a good idea to explain the patient what you are going to do. So I explain the patient what I'm going to do, and then we'll make transfer. So to make transfer, first you must ask the patient to hold the hands together like this, and then you make sure one of the knee bend, and then from the pelvis and the shoulder blade you roll over the patient to the edge of the bed, and then you make sure the legs placed like this to the edge of the bed, and then from the trunk of the patient body you lift it up, and then you make sure the patient feet touch the floor. So if she is cooperating, you can ask the patient to bend over a bit. So if the patient feet touch the ground, you make sure you lock the wheelchair and it's stabilized. You make sure footrests are apart. In some cases, you can also remove this armrest also. And then if the patient needs the minimal assistance, so I can ask her to help with the transfer also. So we are going to move from the back to the wheelchair. Since you can stand, I will maybe we can cooperate together to move. But I will be here for the security all the time. So first you hold the one edge here, and then on the count of 1, 2, 3 we will move. Okay. So are you ready?
Yeah.
1, 2, 3, up. Okay. Slowly we go. Ask the patient sit properly on the wheelchair. So move backward, and then you make sure you secure the seat belt, and then you make sure the footrests are placed comfortably for the resident. Now we are going to make transfer to the resident with moderate assistance. So you make sure you place the wheelchair in line with the back with a small angle, and then you adjust the height of the bed to your walking comfortable position. Okay. Then you explain the patient what you're going to do to them. And then you ask the patient to hold the weaker side of the hand with the stronger side. And then you bend one leg, and then from the pelvis and the shoulder, you roll over the patient. And then you make the legs drop down the back, and then you lift from the trunk of the patient. And then you want to adjust the position patient to lean forward. You make it lean the patient, and then you adjust. And then the other side, you adjust a bit. And then you make sure the patient feet touch the ground. You can lower the bed also. So make sure the patient feet touch the ground. And then you pull the wheelchair near to the patient. And then make sure it's locked. And then you ask the patient to hold one hand to the wheelchair. And then you lock the knees between the patient's legs. And then you ask the patient to lean on you, and then we will make transfer. Make sure your point of view is not blocked by the patient. Okay, on the count of 1, 2, 3, we will make transfer. So you ask the patient to lean on you, and then 1, 2, 3, we will make transfer from the back to the wheelchair. And then you position the patient to the proper position by adjusting. So you ask the patient to lean on you this side, and then you move. And then lean on you this side, and then you push in. Then don't forget to put the security belt, and then you put the patient foot rest well on the footrest. Now we are going to make transfer the resident who needs maximum assistance, which means they may be bedridden or totally bedbound. They cannot move. So first you adjust the height of the bed to your walking comfortable height. And And then you make patient one hand like this, put the other hand like this to avoid when you roll over, don't press over the other side. And then you bend one knee from the pelvis and the shoulder, we roll over the patient. And then make sure the patient legs drop down. And then from the trunk, we will lift the patient up. In case if you cannot carry alone or move alone, you can always ask your colleagues or helper to help you from the other side. So if you need to adjust the position, then we can adjust the position by asking the patient to lean on you, to push a little bit, and then the other side, you push a little bit near to the edge. You can also adjust the height of the bed by lower it down. You make sure the patient feet touch the ground. After you make sure the patient feet touch the ground, you make sure you pull the wheelchair near to you and lock both sides. And then you lock your knees between the patient legs, and then you make sure the patient lean on you, and you make sure the point of view is not blocked by the patient also. And then we will use the leg muscle to make transfer, so you squat it and don't forget to put your back upright. So on the count of 3, we will make transfer. Okay. 1, 2, 3, go. Okay. Now the patient is on the wheelchair already, then we will adjust to the proper position. So as the patient to lean on you, you push in one, and the other side, the patient lean on you, you push in also. And then when you get the proper position, you don't forget to secure the seat belt. And then you make sure the patient feet will rest on the footrest.